Good day to all the students watching this video. The module for the short learning program, Teaching Learners with Autism, focuses on Understanding Autism Spectrum Disorder. And the module code for Module 1 is CSAU16. My name is Dr. Mary Clasquin-Johnson, and I'm presenting this presentation on behalf of my colleague, Dr. Gloria Ledwaba. There you see her email address. Please contact her or me if you have any questions for us, if we can be of any support to you. Dr. Ledwaba is off on sick leave, but we didn't want to reschedule. So apologies and warmest regards from Dr. Ledwaba. In Module 1, the focus is on understanding autism spectrum disorder. There are 4 main sections in the study guide, and you'll see that it addresses the history of autism, the nature of the condition, the possible causes, although we do not know for certain what causes autism. The possible causes are discussed, as well as the prevalence. And we discuss how the prevalence appears to be increasing and explore the possible reasons for the increase in prevalence, given that the diagnostic criteria has changed over time and is influencing the likelihood of usually a learner as a young child in the first 3 to 4 years would, have a formal assessment process by medical practitioners and then potentially be diagnosed with autism. In the next section of the module, we discuss the medical model, the social model of disability, and then we promote a strategic combination of these 2 models. So in other words, we argue that we want diagnosis to be followed by intervention and support. So the social model is promoting social inclusion and inclusion in the long term in the world of work. So this is a strategic combination because we bring the 2 models of disability together and argue that they shouldn't be seen as completely separate. In the 3rd section of the module, we discuss social justice, human rights, and inclusive education. This is the sort of philosophical underpinning of this module, but also of all the work that we do in the Department of Inclusive Education at UNISA, where Dr. Ledwaba and I are based, although this program is presented for the UNISA Center for Lifelong Learning. In the final section, we look at the diverse cultural perspectives of autism spectrum disorder and look at how, at a community level, individuals from different cultural backgrounds might respond and then, engage with individuals who have a diagnosis of autism. But what we ultimately want to see is that there is social inclusion and social justice for every individual on the spectrum. So to look at the historical developments in a little bit more detail, it's important for you as a student on the program to be able to formulate your own definition of autism spectrum disorder. And we look at how this definition is actually quite a fluid phenomenon. It's constantly changing, And it needs to continue to do so because our understanding of autism and the complexity of the condition is evolving and changing. And hopefully, as we understand autism better, we are better equipped and motivated to provide meaningful support for all the learners within our classroom. So, in this program, we've had many parents who have completed the program, but also other individuals who work or provide some support to learners across the lifespan who have a diagnosis of autism. And at the moment, we have a large group of 300 teachers in the Eastern Cape who are also on the program. And so for the first time, we have mostly teachers. So it's very important that we understand autism and we're able to provide a very clear definition of what autism is, because this definition determines how we understand the condition and how we support individuals who have autism. And then we strongly urge our students to avoid stereotypes and discrimination of people who are different, who are neurodiverse, and we promote alternative framings or narratives or storylines that actually embrace the diversity of autism. Here you'll see on the diagram, there are many complex comorbidities, including, attention deficit disorder, anxiety, there's Tourette syndrome, there's giftedness, there's auditory processing challenges, also attention deficit hyperactivity disorder. So you'll see in the diagram, autism spectrum disorder is even more complex because it could have these comorbid conditions that accompany the autism diagnosis. But our main argument is that we need to avoid stereotyping learners who have a diagnosis of autism. And so we promote through our work an alternative framing of autism spectrum disorder, what we call reframing or alternative framing that embraces the concept of neurodiversity and differability rather than disability. We embrace different abilities of our learners in our classrooms and in our communities. So in the next section of the material, we look at why the prevalence or the diagnosis of autism is increasing, not just in South Africa, but globally. And there's possible reasons that are discussed, which include increased awareness of autism, broader diagnostic criteria. We know that the diagnosis and diagnostic and statistical manual, the fifth edition, has consolidated all the subcategories. So previously we had Asperger's syndrome, we had pervasive developmental delays, not otherwise specified. We had autism as different, subcategories. Now we just have one umbrella categorization or differentiation that looks at, these two common criteria of challenges related to social communication and interaction, as well as restrictive and repetitive behaviors. So those are the two, most commonly occurring characteristics in individuals who have a diagnosis of autism. And then we find in our research when we work with schools that teachers' understanding of autism as a spectrum condition is quite limited, and instead teachers tend to simply look at high functioning learners who need low support. Usually that's the assumption. And then low functioning learners who need high levels of support. And, we've argued that there's a need to unpack this term spectrum and actually understand, as you've seen in the previous slide, all the complexities that might also accompany an autism diagnosis. So it's much more complex than just high or low functioning. And of course, if you have high and low, you also have a middle and anything between high and low. So really, there's a need to really grapple with what we mean by the term spectrum. So in the next section of the study material, we focus on the diagnostic criteria. You'll see on page 12, we have table 1.1 that looks at, the different terminology that is used to frame or to describe or define autism spectrum disorder. And you'll see these are the terms that are used in the diagnostic criteria. It includes words such as deficit, abnormal, reduced, failure, restricted, stereotyped, inflexible, extreme distress, impairment, disability, and developmental delay. And so we question, what is the message here? All these terms are overwhelmingly negative, and we don't want teachers to be so overwhelmed by these negative terminology that it almost seems as an impossible task to include and support learners who have, a diagnosis of autism. So we ask students, do you agree with us? Do you disagree? Why would you agree or disagree? I am a parent practitioner, which means that I have a son with autism. And if I look at these terms in relation to my own child, I disagree that that all these terms should be applied to how his support needs are understood and how everybody who works with him either in a classroom situation or in a therapy situation, then understands his needs and his challenges. So not to negate the challenges, but these negative terms don't take us to where we want to get, which is a social inclusion. So please reflect on this. It's important for us to understand the role of early intervention and who is involved in the process of early intervention. So, we would argue that very often it's the teachers within our early childhood development centers, also parents who are able to identify if there are what is termed developmental delays. So we do see our children in classroom situations in relation to their peers, and we can see where there are challenges. Parents who have older children or other children may see differences between the child who has developmental delays as compared to typically developing children, where parents do not have other children. They tend to take longer to recognize or to play this role of early identification. But the child does leave the home and have experiences, for example, in our early childhood development centers, where that early identification may happen. And for us, the importance of early diagnosis, it's not by the teacher or the parent, but by a qualified medical practitioner, is crucial because it should lead to early intervention by a support team. And so if diagnosis is delayed, then intervention is delayed. So we do promote the idea of early diagnosis being made because that should be the spark for support services to be activated. And we see early intervention as having to be individualized to meet the specific needs of the individual for it to be appropriate. So not just any intervention, but appropriate intervention. And the literature tells us that where there is early intervention, learners usually have improved outcomes in the short and the long term. So if a child has, for example, speech therapy, then the communication challenges can be reduced or overcome, and the learner is usually more likely to be verbal. Where intervention does not happen and where there is delayed intervention, we usually see reduced positive outcomes. So there may be much longer speech delays, or the learner may even remain nonverbal. And then again, appropriate support needs to be provided. So one of the strategies we promote in this program is augmentative and alternative communication for learners who have complex communication challenges, including those who are nonverbal. And then we know that diagnosis tends to be a very lengthy and a complex and costly process. Because there's such a small group of medical practitioners who are qualified to do these specialist diagnoses, it leads to parents waiting for months and sometimes even longer than a year to obtain a diagnosis of autism. So the process takes a long time. It's also complex because many parents report that they might have different diagnoses at different times and by different practitioners. So you could have a diagnosis of obsessive compulsive disorder or attention deficit hyperactivity disorder, autism spectrum disorder. So as we know, these could be comorbid conditions, but at a particular point in time, children may exhibit some characteristics more than others. And so to have a repeated diagnosis or different diagnosis is costly because each time the parent is paying to obtain these specialist assessments. So we know that the comorbid conditions that accompany an ASD diagnosis are complex. The comorbid conditions are discussed in your study guide from page 17 to 19. We also present the possible causes. As I've said, we do not definitively know what causes autism. There may be a range of possibilities, and this is discussed on page 20 and 21. And then we look at the prevalence and how this has increased recently over the past, say, 2 decades, and that is discussed on page 22 and 23. So a closer look at the medical model then enables us to look at what is the goal of this medical model. Historically, it was to increase awareness of autism, to promote earlier diagnosis, and we agree with this. As I've previously said, earlier diagnosis should lead to earlier intervention and support. We also look at the importance of someone who's been diagnosed with ASD to have access to appropriate services and supports. Historically, the focus has been on how to eliminate or reduce autistic behaviors, mainly through therapeutic interventions. The next emphasis historically has been on identifying both genetic and environmental factors that could contribute to the prevalence of autism, and then an increased awareness of the prevalence of autism. So that has been the goal of the medical model. And these have implications. So we ask students to consider which of these aspects do we still need when we are in a social inclusion paradigm, which is reflected in all our policies and our education programs in South Africa, but also in many, many countries globally. So in contrast, the social model emphasizes that individuals with disabilities are not disadvantaged by their challenges, but instead by the restrictions or the barriers that are imposed on them by cultural, economic, social, and environmental conditions or barriers, as we've said. So these are obstacles, that prevent individuals with autism from reaching their full potential. And you'll see that a lot of this is about how people encounter, stereotypes, discrimination, and these practices that are very prevalent then lead to social exclusion. And that is what we are trying to address and overcome. So if we want to see inclusion in our society, we need to have inclusion in our schools and in our classrooms from as early as when a child enters an early childhood development center throughout the schooling system and the education system. So we also want to see inclusion within our post-schooling institutions, our TVET colleges, our higher education institutions, and of course, within the workplace. That is social inclusion. So in the social model, we emphasize that it is not about fixing or curing autism, but rather about accommodating diverse needs and improving the social and the material environments in which our individuals with autism live, learn, and work. And so our emphasis in this module is about acceptance and appropriate support. So since the module was developed by ourselves as, academics in the Department of Inclusive Education, the whole paradigm in which we work and teach and conduct our research is human rights, social justice, and inclusive education. So we see education for people with diverse needs and abilities as a fundamental rights issue. It's about the fundamental right to quality education. And so it goes way back to the Universal Declaration on Human Rights of the United Nations of 1948. And then, of course, we have our own constitution in South Africa of 1996. But there's a host of legislation and policy, treaties, conventions that we have adopted in the last uh, several decades. But if we focus just on what we've adopted since 1994, in the post-apartheid or democratic South Africa, then it's all based on the concept of education for all and the right to quality education. And we then question to what extent we, as teachers, implement this in our schools and classrooms, and how we as teachers ensure that every individual with autism is afforded his or her fundamental right to education, how we accommodate them within our schools and classrooms, how we teach them, how we support them. The role we play is needed to or has to align with this fundamental right to education. So we take responsibility for reducing barriers and for ensuring that every learner can access their right to education. And then finally, in the last section of this program, in this module, we look at the diverse cultural perspectives on autism. And you'll see that certain communities that may have specific cultural backgrounds may look at disability as punishment for sin or as a gift from God, very different. Also looking at ASD as neurodiversity, as a form of giftedness. So where the emphasis is on what the learner can do and the incredible strengths that many of them have, rather than the challenges or the deficits or the impairments. The emphasis is on the ability and to appreciate autism as a natural form of human variation. It recognizes that all of us are different and that that is something that we should celebrate and respect. And then also look at autism as individuals who are differently abled rather than disabled. And so we encourage you to guard against the stereotypes. You'll see that there has been stereotyping in the way the content has been presented, where it looks at this culture sees it this way, that culture sees it that way. And we're saying, no, people from any culture, if they've encountered um, individuals with autism as parents and teachers working, living with, loving individuals with autism, we should understand it differently and therefore guard against the stereotypes, because ultimately everything we do is about embracing and respecting the diversity of our learners and ensuring that we as teachers and other stakeholders are able to work together to provide appropriate support. Thank you very much. If you have any questions, please feel welcome to contact your lecturers.